Thank you very much, Dr. Roman. Before we proceed to the presentation, I would like to acknowledge some of the guests who took the time to come here this afternoon and participate in our forum. I am going to read their names in no particular order. Ms. Monina Bukat from the Office of Honorable Arthur Pingoy, Committee on Health. Dr. Esperanza Cabral, Secretary of the Department of Social Welfare and Development. Mr. Christopher Redemson Dembrocales from the Office of Senator Honasan. Mr. Efren Elane from High Isay Pharmaceutical Industries. Dr. Vivian Eustaquio from the Office of Senator Pia Cayetano. Pastor Romeo Gaspar, General Manager, Kabalikat ng Botica, Binhi. Sister Normita Guevara, President, Philippine College of Hospital Administrators. Mr. Benjamin Longid from the Office of Senator Honasan. Dr. Benito Reverente, Prudential Life Healthcare Incorporated. Dr. Fernando S. Sanchez from the Association of Philippine Medical Colleges. Dr. Charito A. Santos, AstraZeneca Pharmaceuticals Philippines Incorporated. Ms. Annabel Saribay from PLCPD. Another representative from Senator Honasan's office, Mr. Javeri Templanza. Mr. Lord Luis Valera from the PRC International Affairs Division. Of course, Dr. Quintanar from the National Academy of Science and Technology. And Ms. Michelle Sandoval from the Office of Congressman Sani Angara. And MMDA Chair Bayani Fernando. We also have Dr. Bernardo Irineo, Secretary General, Philippine Medical Association. Now, let me introduce our panelists. Dr. Ernesto Domingo, University Professor Emeritus and former Chancellor of UP Manila. He served as a member of the UP Board of Regents as a faculty regent. Dr. Alberto Romualdez was Dean of the UP College of Medicine from 1984 to 1988 and Secretary of Health from 1998 to 2001. Currently, he is the Dean of the Graduate School of Health Sciences at the Pamantasan ng Lungsod ng Maynila. Dr. Junice Lirza Demeterio Melgar is the co-founder and executive director of the Likhaan Center for Women's Health since 1995. Dr. Kenneth Hartigan Go is a graduate of UP College of Medicine and a pharmacologist toxicologist by training. Dr. Hartigan Go is currently the executive director of the Zwilig Family Foundation. Dr. Jonathan David Flavier is a professorial lecturer on health policy and administration at the UP College of Public Health. Currently, he provides technical assistance to various health-related programs and projects. The presentation of the 6 guest panelists, whom I have just introduced, will be followed immediately by the open forum. Our moderator is Professor Randolph S. David. Professor David is currently full professor and chair at the Department of Sociology, University of the Philippines, Diliman. He has been a member of the UP faculty since 1967 and has served as a member of the UP Board of Regents representing the faculty in 1999. Ladies and gentlemen, We now invite you to watch and listen to the presentation on Moving Towards Universal Healthcare. What needs to be done?
Two of the UP Centennial Lectures of 2008 identified equity as the country's main health problem and proposed a role of the university in addressing it. The lectures were followed by a series of consultative meetings between a cross-section of academics, health providers, and other health stakeholders in an attempt to outline reforms aimed at reducing health inequities. The results of these discussions are presented in today's forum to initiate a series of actions that will hopefully culminate in a national effort to provide universal health care for Filipinos. Health is a basic human right guaranteed by our Constitution. However, the great disparity in access to and use of health care, resulting in significant differences in health status between the rich minority and the poor majority of Filipinos, constitutes a grave violation of this right for most Filipinos. Conventional health status indicators of life expectancy at birth, infant and child mortality, and maternal mortality ratio show considerable variation when disaggregated according to income groups and geographic location. Rich urban communities like those in Metro Manila, Cebu, and Davao, with access to modern facilities, have outcomes comparable to those of developed countries. That is, life expectancy at birth over 80 years, infant and child mortality less than 10, and maternal mortality ratio less than 15. In contrast, poor rural communities, such as those in Bicol, the Samar provinces, and ARMM, have results that approach those of least developed countries. That is, life expectancy at birth under 60 years, infant and child mortality over 90, and maternal mortality ratio over 150. While not quite as bad as least developed countries, urban poor communities have indicators that are from 2 to 5 times worse than their neighbors in gated villages. To address these deficiencies, radical reforms in all components of the Philippine health system are required. Such reforms must be aimed at achieving universal health care in the country over a reasonable period of time, which would be 10 to 15 years. This means that every Filipino should have access to high-quality health care that is efficient, accessible, equitably distributed, adequately funded, fairly financed, and directed in conjunction with an informed and empowered public. The overarching philosophy is that access to social services is based on needs and not based on the capability to pay. This ultimately places people at the center of socio-economic development.